My name is Neha Raukar. I'm an emergency medicine and sports medicine physician at the Mayo Clinic. I also work with the U.S. ski and snowboard team and with USA Hockey and with U.S. figure skating. I'm here today to talk about concussion, something we see all the time in sports, but something we see in real life as well. What we learn about concussion, we've learned a lot from what's happening on the sports field, but we're able to take what we learned there and bring it to everybody. And so everybody benefits from all the research that happens in athletes. Today, we're going to talk about concussion, what it is, how to manage it at home, what to expect when you go to the doctor's office. And we'll talk about some myths because it seems that, especially when it comes to concussion, there's just so many myths out there and so much misinformation. So I thought this would be a great place to address them all. So the first thing is, what is a head injury? What is a concussion? Head injuries can be classified as mild, moderate, or severe. And it's based on your presentation, like your presenting signs and symptoms and how you look at the time of injury. Did you lose consciousness? Were you confused? Did you have this open wound and you were bleeding? What was the mechanism? And we use all of these little data points to decide if this was a mild head injury, a moderate head injury, or a severe head injury. A concussion falls under the category of a mild head injury. That being said, that doesn't mean that you can have or you cannot have long-term symptoms and that it can't be debilitating. They certainly are, even though we classify it as a mild head injury. So then the next thing to think about is, which of these patients who have this head injury, if you watched it happen, who goes to the emergency department? Who should you say, hey, I think that you should be evaluated right now as opposed to follow up with your doctor in a few days? What are the clues that tell you this person should be evaluated? So the things to think about when you're looking at the person who was injured is one pupil bigger than the other. So the black part of your eye, if one of the eyes, the pupil is bigger than the other one, that's the sign of a more severe head injury and something that should get looked at. Somebody who's persistently drowsy and can't be awakened. Somebody who has a headache that's just so severe and it won't go away. Somebody who keeps vomiting or complains of persistent nausea, that should certainly be evaluated. And of course, if you see somebody have a seizure, or if they seem like they don't know who you are or who they are or where they are, like they should know these things, right? Then those people should as well be evaluated. And then even people who lose consciousness should be evaluated because that could be a sign that there's something deeper and more significant going on. So what happens with a concussion? There's been so much research into what happens with a concussion, and we have some ideas about what's going on. I think the best way to describe this is cotton candy on a stick. We've discovered that it's not just the impact of the person or the impact that the person is feeling. It's really the rotational energies that the person's experiencing, that their brain is experiencing. And that's what correlates with concussion symptoms. So it's not just the direct trauma, it's the symptoms of the brain rotating slightly, ever so slightly. And by rotating, it shears or it stretches these axons. So when I think of cotton candy on a stick, I think of a hard stick and then cotton candy, which is very soft. And when it has some energy exerted on it, yes, there's some direct impact, but there's also a little bit of rotation. And the fibers that connect the cotton candy to the stick, they stretch. And that's what causes the symptoms of a concussion. And I think understanding it this way helps you to understand that concussions can happen even without a direct trauma to the head. It can happen as trauma to the body, and you have some whiplash, and that's going to cause a little bit of rotation of that cotton candy on the stick. And I think that helps you understand that this can happen even without the head injury. Once this happens, your brain is vulnerable, right? And so the goal of all treatments and all therapies is to protect the vulnerability of the brain, which means to protect it from being injured again. So everything I will tell you as recommendations and everything that you will hear as recommendations is all to protect the vulnerability of this injured brain, right? And why do we need to protect that? Well, lots of research has found that if you sustain another head injury before your brain is completely healed, it can lead to devastating consequences such as death. And that's called second impact syndrome. But even without experiencing second impact syndrome, even if you survive the second impact to your head, you will have symptoms that last so much longer and are so much more significant and so much more severe. And so what could have been a short recovery is now turned into a really long recovery. So we do whatever we can to protect you from having this second impact. So we talked about the signs and symptoms of a concussion, or I sort of alluded to them earlier, but let's talk a little bit more about what they are. We typically classify concussion symptoms into 4 categories. The physical category, like I have a headache, I'm nauseous. The cognitive or thinking category, like I'm feeling foggy, I can't really remember things. That falls under your cognitive umbrella. Then we have a whole category of sleep symptoms, and you'll notice that people who are head injured either sleep a lot or can't fall asleep and have insomnia. So this whole spectrum of sleep disorders falls under this umbrella of sleep symptoms. And then the final category is emotional. We say emotional, and that really means that people are either their personality or that their emotions are very friable. And so they're more likely to just cry with a really low, like low threshold, or they're just inappropriate. They just are more emotional in general. Most concussions do not have a loss of consciousness. In fact, only 10% of concussions have a loss of consciousness. And so just because somebody does not lose consciousness, does not mean that they cannot experience these symptoms. They may still be concussed. So keep that in mind. Somebody may have gotten hit in the head or the body, and they never lost consciousness, but they're not acting appropriate and they're complaining of a headache or nausea or vomiting. You should think about, could this person be concussed? So we have all these symptoms. And one of the questions I get asked all the time is, well, what do you think? Do you think we should just give the person some medication, some over-the-counter medication, and manage their symptoms or reduce their symptoms, and then they can live their life and then we're done having this conversation? Well, that's a great idea. However, the way I want you to think about the symptoms of concussion and its recovery is as money in the bank or tokens in the bank. And so you live your life and you have all these tokens and you build up tokens and you have all this reserve and you're able to push yourself even when you're tired or even when you know you need to take a break, you're able to push yourself. What happens when you have a head injury is all of a sudden your bank is eliminated. You have no more tokens left in the bank. And so every time you have symptoms, that means that you're using up tokens that you don't have. And the more symptoms you have, the more you're going into the negative, which means that at the end of the day, or at some point, you're going to have to pay. At some point, you're going to be so significantly symptomatic that you're going to crash. You're going to want to sleep and just let your body build up its reserve, build up its tokens again. And so by taking medication, let's say, for example, the person has a headache and you take ibuprofen. That's great. The person does not have a headache. You don't see it. You don't feel it. The person seems fine, but they're still borrowing those tokens against the bank. And so now the only thing is now you don't know. You don't know if they're having symptoms because you've masked them. So my recommendation would be, yes, if you have something important going on and you need to manage those symptoms, yes, by all means, manage the symptoms. But know that when the medication wears off, you may have more symptoms than you did before because you were unable to assess how the symptoms were getting worse. So medications, we're very cautious about giving medications, both in the emergency department and in a sports medicine clinic, because we don't want to mask the symptoms. We want you to be able to see how you're feeling. One of the important things is really good sleep and sleep hygiene. We recommend sleeping quite a bit just to give your body time to recover. But what does good sleep hygiene mean? It means sticking to a schedule, having a good bedtime routine, exercising regularly, keeping your room dark and at a comfortable temperature, and only doing things in your bedroom that don't involve electronics, like no TVs, no computers, no scrolling on your phone. And then during the day, watching what you eat and drink so you have good sleep hygiene. There's this rule, the 10-3-2-1-0 rule for sleep hygiene. And what that means is 10 hours before you go to bed, you don't have any caffeine. 3 hours before bed, you stop eating, no more food. 2 hours before bed, you stop working. And 1 hour before bed, no more screen time. So that way, when it's time for bed, your brain and your body is ready to fall asleep. This is really hard to do in a concussed person. But if you can stick by this rule, people do recover quicker. Now, some important questions. Do concussions heal on their own, or do you need some kind of intervention to make them heal quicker? Well, in short, yes, your brain has this remarkable ability to heal on its own.